bioadaptor randomized control trial. I do not have any conflict of interest. This is a randomized control trial, 34 global trial sites in Japan, Europe, New Zealand. So we are sincerely grateful for all collaborators. Looking at the background, so this is a rate of target lesion failure. So even in contemporary second death, so target lesion failure keep going up event rate after 1 year. Blue line is drug coating balloon groups. As you can see, drug coating balloon is also keep going in terms of cumulative incidence of target lesion failure. To date, so these are so remaining clinical issue. This bioadaptor stent is bioadapter is well designed to adapt to so vessel physiology. First 6 months after implantation, a bioadapter supports the vessel wall like contemporary drug editing stent. 6 months later, after implantation, so link is disconnected and result in vessel was disengaged. These function potentially contribute to future reduction in coronary event. So this is our hypothesis. So 2 randomized control trials already published. As you can see in the both trial, so after 1 year, after 6 months, so event rate appear to be plateau like this. These feature could be seen in both randomized control trial. This is a bioadapter randomized control trial flowchart. So this trial included 445 patients were enrolled. So 1-to-1 randomized trial, randomly assigned to 1-to-1 bioadapter group and Resolute Onyx groups. A primary endpoint was 1-year clinical follow-up in terms of target lesion failure. So today, we'd like to talk about 4-year clinical outcome by adapter randomized control trial. This is a baseline characteristics. Left side is patient characteristics, patient background. Right side is lesion characteristics. As you can see, so LED lesion is approximately 50%, and the bifurcation lesion around 24%. So more complex lesion is included in this clinical trial. So any compounder is well balanced between 2 groups. Looking at the 4-year clinical outcome, as you can see, significant differences between 2 groups. Notably, 1-year follow-up, so event rate is quite low in vascular event is significantly lower in bioadapter groups. Looking at landmark analysis, as you can see, after 6 months, significant lower event in bioadapter groups. As you can see, the difference keep going to significant p-values. This slide shows a target lesion failure outcome in LAD region. This is a subgroup analysis in LAD region. Even in LAD regions, as you can see, significant difference between two groups. This slide shows the incidence in target vessel failure. As you can see, significant difference between two groups. So clinical event is more significant reduction in target vessel failure in bioadapter groups. This is our conclusion. Bioadapter randomized control trial demonstrated significant lower target lesion failure rate. Also showed a significant reduction in cardiac death and substantial clinical benefit in LAD regions. Thank you so much for your attention.
Thank you for showing those important long-term outcomes with the bioadapter and the bioadapter randomized control trial. Antonio, you're a user of bioadapter. I think, what is your comments on this trial?
But you know, my comment is also a question for the presenter. And then I give you my comment. In Japan, is this device available for clinical use or only inside trials?
Thank you so much for your question. So your question is, so bioadapter is available in Japan or so?
Yeah, is available for general use or only for clinical trials?
Yes, and now, so not available in Japan because in the near future, so it will be available, maybe this year.
Okay, so my consideration is, you know, with these results, I already said this 1 year ago, why this device is not more routinely used? Because, you know, honestly, these results are quite impressive. If I had a stent tomorrow, I would like to have this device and makes sense. So it's, I know the price is not competitive, but this procedure is not like going to the dentist. For some people are relevant procedures.
No, sorry, but I must agree with what you say, because if you look at the target lesion failure and target vessel failure, they are 2.8% and 3.3%. This is at 4 years. This is extremely low. So honestly, I don't remember if I've seen something similar to that. So how can you explain? Because I also saw that you have 20% calcification rate. Heavy calcification, which is not extremely high, but is in the range of the Renovate complex trial, which is quite complex. So how you explain that is doing so good in simple but not that simple lesion? Is only because the vessel reacquired the vasomotion, let's say?
Thank you so much for nice question, nice comment. It have been reported that using bioadapter is associated with long-term vessel function, such as increasing blood flow and good vessel function result in a nice vessel remodeling. That feature might contribute to lower event in target vessel. So I think much more data we have to need to further analysis.
You know, we published, I think this year, in American Journal of Cardiology, first author is Pier Pasquale Leone. In complex lesion, I think we are 54. We did rotablation, lithotripsy, so there are real many CTOs with routine angiographic follow-up, and we had only 4 or 5 revascularization out of 54 with routine angiography, and we know that routine angiographic follow-up triggers reintervention. So it goes along with your data.
Well, my comment also is in the same direction. We have 3 years, 4 years data showing mortality benefit, not only the recurrence benefit. And yet we're not seeing it, being used frequently, commonly, and I don't think it is US FDA approved as yet. It's not. It's not.
Well, thank you, everyone. This has been a lot of fantastic data. I think we all recognize that we've reached a plateau with drug-eluting stents in terms of event rates, and it's really refreshing to see new technologies trying to push the envelope. So what we did see today is bioadapter sub-analysis on intracoronary and physiology evaluation. We saw long-term outcomes, 4 years for this technology, which is very promising. We saw something very new from site-specific antithrombotic. We're really excited to see where this will head, Dr. Abizaid and his team. And of course, we also saw the thinner strut fire absorb, very promising results, and we're hoping to see a little bit more come out of that technology as well. So thanks, everybody, and hope to see you in other sessions.
Thank you,
Thank you. Good seeing you.